February might be the shortest month on the calendar, but it certainly doesn't fall short on holidays or observances. Among these is the Sexual and Reproductive Health Awareness Day, which falls on February 12. In commemoration of this Awareness Day, Lifeline is here to help you uncover essential knowledge and insights about sexual and reproductive health. I am Noemi Roslinda, welcoming you to another episode of Lifeline, the show where we improve our lives by feeding our minds. Joining us for today's episode, we have an obstetrician-gynecologist and gynecologic oncologist, Dr. Jocelyn Zamora-Mariano, MD. So welcome to Lifeline, Doc, and we are so glad to have you here. So before starting with the topics regarding sexual and reproductive health, may you explain to us the awareness of the audience on what your specialty of the job is and what's its job description?
Good afternoon. I'm an obstetrician-gynecologist. I deal with women's childbirth and diseases, but I have a subspecialty, and this is gynecologic oncology, wherein I have a particular, I pay particular attention to women with pelvic cancers.
Yes, we have a very experienced host or guest with us here today. So with that said, we can now start with our first round of questions. So Doc, what is the scope of sexual and reproductive health?
Sexual reproductive health entails a state of knowing the physical, mental, and social well-being regarding sexuality, matters that would require knowing what sexuality is and how it affects reproductive health care. So it doesn't just talk about having to deal how to have sex with your partners, but it entails having to have responsible knowledge regarding sex education, because you would like to prevent outcomes such as that of teenage pregnancies, which is happening a lot nowadays. We have a higher incidence of teenage pregnancy going on nowadays, and this boils down to major problems such as having, as a gynecologic oncologist, teenage pregnancies may lead to cervical cancer. Having to be exposed at an early time with a lot of partners, having an early sexual debut, having many children in the process. This will probably, these are risk factors for developing cervical cancer in the future. So sexuality or sexual and reproductive health entails having to deal or give the information to the younger ones in order that they may be able to understand and comprehend how to be responsible parents in the future. So we start with sex education and end with responsible parenthood later on.
So to be more informed on our sexual and reproductive well-being, are there any distinct early symptoms of reproductive health diseases and STIs that people should look out for?
That's a very good question, because sometimes we just go to our doctors because you already feel something that's bad about some feel bad about ourselves, and we try to seek consultation. But what we would like to inculcate is that you should be able to seek consult with your doctors when you don't feel anything, because we would like to educate ourselves on what our sexuality really is. So having to know when your normal menses should really happen will help me prevent or know more if what I'm having now is abnormal. For example, I know that the normal menses should happen for this long, 24 to 38 days. And then I would only have bleeding for about 7 days only. But if I have a duration of my menses more than 7 days, or if my intervals of menses would happen longer than 38 days, I have to seek consult already, because it may affect my fertility status in the future. I may have problems getting pregnant in the future. I may have problems having with my menses. Baka may PCOS na ako. It's a common thing that bothers a lot of adolescents and a lot of women nowadays. That's why it's important to take note of this. We do not have particular signs and symptoms, but when you know something of the normal, then you'll be able to say that this is beyond what's expected, so I have to do something about it. And that's the time that you can consult. But you have to know something that's basic and something that should be known by every woman so that they will be able to deal with their problems later on. So, anong mga common signs and symptoms? Bleeding, no, abnormal bleeding, longer bleeding than the usual. There's too much pain during the menses, inability to get pregnant. Probably her not getting usual menses or regular menses can affect her getting pregnant in the future. So this becomes a basic knowledge that she should know so that she'll be able also to predict when she can get pregnant, when can she have safe sex with her husband and not get pregnant because they're planning on their family. So being in the Royal and Pontifical University, it's a must for us also to introduce natural family planning as a way of responsible family planning for our couples.
Ayan, I agree. And we have to be on our tip-top shape of our healthcare po. So, how can someone reduce the risk of contracting these infections and diseases po?
Okay, it's important to always have a monogamous life. I always have a mnemonic for my during my lectures, and I end my lectures by always saying, the only thing that I would like you to remember is that kiss. You keep it simple and safe. Okay, so maintain a monogamous relationship, and because you are in constant communication with your partner, you know when to have your sexual intercourse, your scheduled intercourse. You'll be able to also decrease the incidence of your partner contracting diseases that may, or sexually transmitted illnesses that may have to be treated, because you can contaminate your partner later on.
So, in short, monogamy can help us but also our partner po.
Dapat ikaw lang, dapat nag-iisa lang.
That is right. So, are there any treatments to be conducted when someone has an STI or any reproductive health disease? And how accessible are these treatments in the Philippines?
Okay, so any abnormal discharge, the normal discharge is supposed to be mucoid. So parang masipon, depende on the cycle. So when it becomes of a different color, meron siya accompanying pangangate or pruritus. Pag meron siyang kasamang kakaibang amoy, these are all things that may have to make you or alert you to seek consultation right away. So that's one symptom, abnormal na discharge. If there's also accompanying pain, then this may have to make you seek consultation. Sometimes, when you go to your gynecologist, they do a speculum examination. So they insert an instrument inside the vagina and have a look at the discharge that's coming out, and then they get a sample of the discharge and do some laboratory examinations for this, and they'll be able to diagnose what type of infection, and from there they'll be given the proper treatment for that type of infection. If there's a mass that they have palpated, then or may pain na nararamdaman, they could also be requested to have an ultrasound so that they will be able to say what is bothering her, if there's something wrong with the reproductive tract. It's always important to take note that when you visit your gynecologist, apart from the speculum exam, they will also have to do a pelvic exam on you. So examinin yung how the reproductive organs would feel like, if it were normal or not, and from there proceed with the diagnostics that will help in the evaluation of what the patient has.
So we should always be on the lookout for abnormalities po.
Yes.
So I'm sure our audience learned a lot from this part of the episode alone, but stay tuned, because when we return from this short break, we'll continue our discussion on sexual and reproductive health. Welcome back to Lifeline, where we improve our lives by feeding our minds. So before the break, our guest Dr. Zamora-Mariano introduced us to the concept of sexual and reproductive health, together with the types of diseases and treatment process. Now, Doc, for this next segment, we're going to do a good old round of mythical operations, where we dissect the truth from misconceptions. So the way this works is we will be reading a statement, and you will say whether it's a fact or a myth, and then explain further why it is the case. So are you ready po?
Okay, I'm ready.
Alright, with that being said, let's proceed with the first statement. So fact or myth, infertility only affects women?
Okay, it takes two to tango. So ano yon, myth yon. Kasi there has to be the sperm and the egg which will have to meet in order for fertilization to happen. So we also have a male infertility problem that arises, and whenever we work up our patients for infertility, one of the first things that we have to rule out or disregard is the problem with regards the male side, because you only have to take note of the sperm count, the character of the sperms, doing a semen analysis for the husband, and a urologic consultation probably, and the rest of the other 5 causes of infertility will be that of the woman's. So it's important that you can't just regard na infertility is just for women. It is also something that involves the male partner.
So it is a myth. Men can also be infertile and can also affect the infertility of women. So next, we have fact or myth. Mutual consent and abstinence are still part of sexual health.
Yes, it is. So it's a fact, no? So that's the essence, particularly with natural family planning. This involves having to have a good communication with your partner, knowing that when she's safe, when the woman's safe, and when she's unsafe. No? So you'll be able to gauge or tell at what particular time they will be able to have safe contact, and if they want to get pregnant, do it on the days that she's ovulating. So that improves the communication between the couple. So that's a fact.
That's a fact. So next, we have fact or myth. Women with polycystic ovary syndrome or PCOS cannot get pregnant.
It's a myth, okay? Because even if you have PCOS, you just have to look at the cause of what's causing the infertility. PCOS can be one of them because we have 6 causes of possible infertility. Among the 5 nga yung sa woman, and the other one is for the man. So if you're dealing with PCOS, you're talking about problems on ovulation. But you have to look at the other causes of infertility as well. Barado ba yung tubo? May problema sa ovaryo? Yung cervix ba niya? The cervical discharge? Is it hostile to the sperms when they come in? No, but PCOS, if a patient comes in with PCOS, we can give them ovulants or something to stimulate ovulation, and we can help them get pregnant as long as the other causes of infertility are also recognized and they're not present in the patient.
So it's very complicated po pala, no?
Yes, PCOS is very complicated because it entails a lot of symptoms, a lot of problems that the patient can have. And you have to address that particular symptom when you're treating a patient with PCOS, because not everybody who has PCOS will automatically be infertile. That's one of the stigma that's given to those patients with PCOS. They say that may PCOS ka, hindi ka na magkakanak. That's not true. Other patients may have PCOS because they have hormonal problems, they have acne, they have abnormal hair growth, they have irregular menses. But although this can lead to getting pregnant right away, but we have to treat what the symptom is presented by a patient who has PCOS.
All right, thank you so much for that, Doc. We also have another one. Fact or myth? Sexually transmitted diseases or STDs can be transmitted in ways other than sexual intercourse.
That's a fact, because there are other ways wherein sexually transmitted illnesses can contaminate somebody else. Skin-to-skin contact, even without penetration, rubbing of the genital skin can also promote sexually transmitted illnesses. Other forms of sex practices can likewise contribute to transmission of sexually transmitted illnesses.
So we should always be careful in order to look out for our own health. So that was such a fun round of mythical operations, Doc. Thank you so much for debunking some of the misconceptions surrounding sexual and reproductive health. And I'm really sure that our viewers learned so much about this topic. And that ends our episode for today. We would love to thank Dr. Jocelyn Zamora-Mariano for taking the time of your busy schedule. So we here in Lifeline are very grateful for enlightening us with your knowledge and helping us spread awareness regarding sexual and reproductive health. So in the words of Marcia Garber, all people deserve accurate sexual health care. As we celebrate Sexual and Reproductive Health Awareness Day, we must remember to break our age-old stigmas and continue educating ourselves. For it is in the mind that leads us to living a healthy and fulfilling life. Once again, my name is Noemi Roslinda, and this has been Lifeline, where we improve our lives by feeding our minds.